I'm very, very excited to introduce today Dr. Yonatan Lahav. He's the Director of Surgery and Vocal Cords, Breathing and Swallowing Disorders Unit. Hi, Dr. Lahav. It's a pleasure to have you here today. You work with many artists, singers, and all the best.
I treat patients for many years now, and I see them in very stressful situations in their lives. I do believe that we have to be experts in what we do. We must get to the most accurate diagnosis. But at least as important is to make the patient optimistic about his or her condition. This is what a lot of time makes the difference.
How do we use our vocal cords when we sing versus when we talk?
People can sometimes imagine the vocal cords like strings of a guitar. Actually, vocal folds are like lips, like our lips. So just imagine that we have a pair of lips down here in the middle of our throat. And when we breathe normally, these lips, the vocal cords are open. So like our voice would be open and we take air in and out. Now, if we will close the vocal cords tightly, nothing will come out. Like when we cough or sneeze, we close them very strong. So this is how we generate the voice. Now we can make the vocal folds very tight. This is how we create a high pitch. And we can make them loose, and this is how we make the low pitch. So this is actually the mechanism of how we generate the voice. But of course, above the mechanical parts of the vocal folds which are here, we have all the things around here. Actually, this is where we create the resonance, the special color of our voice, and from here and from our heart, this is where we create what we call the soul or the special characteristics that defines us. Our voice defines us as people. When you are shy, or when you're a quiet person, or when you're a talkative or extroverted person, it's all in your voice. So first impression is many times by our voice. Now, if we want to talk about the differences between voice of speech and voice of singing, it's very interesting because it's operated in different parts of our brain. And above these, there are two more interesting things. One of these is the skill of knowing how to sing. So you can have the best vocal folds, but you will be an awful singer. And vice versa, you can have quite a bad looking vocal folds, but you can still be a great singer if you know how to use them. So this is the art of singing. And another thing very interesting about singing is a different state of mind. Singing is not like talking. It's a kind of therapy. If you take a patient that stutters or is too frightened to talk in front of an audience, but you will let him sing, he might perform much better.